So we are, first, before I dive into the presentation, I just want to say that Prime is so excited to have the local government back as a client. So effective January 1st, as Michelle mentioned, you guys are coming back. You were with Prime about 4 or 5 years ago. And again, we're so happy that you're coming back to Prime. So today what I'd like to talk about is the transition process and some things that you can expect over the next couple of months going into 1/1. So that will be related to member resources, the transition process and support, call center and communications, and then how you can access to myprime.com after the effective date. And then we will also go into specialty. We understand that some of your members are taking specialty medications today, so we will talk to you about how that transition process will happen. And then Accredo is our specialty provider. So for those members currently taking specialty medications, there will be a very detailed and thoughtful transition process. Okay, so Michelle said, welcome back to LGHIB, and again, we are so excited to be back. Just a little bit about Prime. Things have changed a little bit since you were our client, but we currently now have about 7,000 employees. We cover on the pharmacy side, PBM services, about 40 million members. We process around 613 million claims per year, and we've been around for 25 years. So we're not a new PBM. Again, we've been around for a long time, and we have, services, full services, PBM services for your members. Let's talk about what will change and I guess what won't change. So again, the go live date is January 1st, 2025, so in a few months. The plan design that you have currently today does not change. That remains the same. Where there is a possibility for change is around the formulary. So Prime has a different formulary than your incumbent, and so there could be tier changes going from either a lower cost tier to a higher tier or vice versa. And so we will communicate to members where there is a negative member impact. So when I say negative member impact, that means members going from a lower cost tier to a higher tier, or maybe a drug that's excluded. So we will communicate to members about that change. When you think about your retail network, just remember that all major chains participate within the retail network. So that does not change. If you're going to, a CVS or a Walgreens, that's still in the network. Where there might be a change is the independent pharmacies. There could be a change within that coverage. But you can find out before 1/1 if you do go to your local mom and pop pharmacy if they're part of our network. If they currently are not part of our network, we will reach out to them and solicit them to see if they'd like to join the network. So from a retail perspective, there should be very little change. As I mentioned earlier, transitioning specialty, those members who are taking specialty medications, typically are the injectable medications, they're high cost meds. So we will, Accredo is our partner, as I mentioned, and they will be reaching out to members who are currently taking specialty medications to help them with the transition. It's important to mention that for members who have already went through the prior authorization process, if you currently have refills active, we will take that claims detail and that will transition over to Prime. So you will not need to go through the prior authorization process again, as long as you have an active prescription. Again, we will take that data from your incumbent and load that into our system, so you do not have to go through prior authorization again. And then for for member inquiries, your members can call our customer service, actually the Blues customer service. We are partnering with them on customer service. So they can call effective November 1st, and we have the phone number over there on a one-page flyer. Call November 1st if you have questions regarding the pharmacy benefit. So as I just mentioned, we are partnering with Blue Cross Blue Shield of Alabama when it comes to the call center. So Blue Cross Blue Shield of Alabama will be answering member calls during the day, and Prime will answer member calls after hours and on weekends. The systems will be integrated so that member information will be available to both Prime as well as Blue Cross Blue Shield of Alabama. We heard that this is good news, but we're happy to announce that you all will be receiving one ID card. So, so it will be a joint card. You can use the same card for your medical benefit as well as pharmacy. You can see an image here, and you can see the local logos here. To access the internet, you can access myprime.com starting January 1st. And so you can see a whole host of things that you can do on myprime.com. You can shop, you can compare pricing, you can find a pharmacy, and you can also track prior authorizations. So if you do need a new prior authorization come January, you can start that process, and then you can go online to see exactly where the PA approval process is. So if it's with the doctor, if it's being reviewed, you'll be able to see that information online. I know for me personally, when I've had a prior authorization in the past, it was just very cumbersome to really understand when you could go pick up your medication, but now you're able to track prior authorizations online. This is really just an image of sort of the PA process and some of the screenshots that you will see. So you will be informed when it's with the provider, when you can go fill the prescription, if there's any possible issues, or if it's possibly even going to be denied. So you can denied, so you can track that online. So I mentioned specialty pharmacy, and we do highlight this quite a bit because these are the medications that patients typically take for chronic and complex conditions. They're injectables. So members, you can really understand and expect similar service as today: free shipping for your specialty medications, access to customer service 24/7. If you're starting a medication, maybe you're having a possible side effect or you're confused on how to inject it yourself, you have access to customer care 24/7. You also have access to a mobile app. So the mobile app would be an Accredo app that you can download. That is the specialty provider. And it really is set up to make sure that you're compliant with these medications and you're managing utilization. So the last thing you want to do is start on a very important, expensive medication and then drop off therapy. So it's really the specialty approach is meant to give you guidance, hand-holding as you manage, a chronic, or your members manage a chronic or complex condition. And so Accredo, just to give you an idea of the process, it really it makes the process easier if you follow it. Keep in mind that it covers about 500 condition-specific pharmacies. There are education nurses who are available to make sure that you understand exactly what's going on with your therapy. You can get one-to-one counseling. So as you go through the transition process for specialty, it's an opportunity for you to ask clinicians any questions that you have when it comes to your medication. Even if there's a possibility, if it interacts with another medication, ask them about side effects. Really use them as a resource to help guide you through the transition process. So Accredo, for those members who are taking specialty medications, Accredo will be reaching out during the transition process before 1/1 to help those members with the transition. So if you get a call from Accredo, that is your new specialty provider as of January 1, please speak to the clinician on the phone to help guide you. And then lastly, I know currently you have a direct member reimbursement process. We are in the process of building that out. So it's plan design perspective, tier 1 and tier 2 and tier 3. You would submit a DMR request. The forms can be located on myprom.com or lghip.org, and you can print those and submit them. and we will communicate to members during the DMR process to help with the transition. So that is a high-level overview of the transition process. And then we have the contact information here if you want to take an image, or we do have a one-page flyer to help you and your members transition to Prime before 1/1.
And we will also be sending out plenty of information to both members and units, so that way everybody stays very well aware of that transition from OptumRx to Prime Therapeutics. Again, we've had Prime in the past. They were our PBM prior to 2020. So we are excited that we get to have those relationships again with Prime Therapeutics, and just having that, it just makes it a lot easier to have one card. I think that's the most thing. When Arlene and I first spoke on the phone, I think that was probably my first question. I don't even know if I asked her how her day was. I think I just said, where are we going to have one card? So we know that this is an extremely important benefit, or part of the benefit that we offer. So we're going to do everything we can to ensure that this transition is as smooth as possible. So you'll be hearing a lot from us, and your employees will as well with that transition. So thank you so much. Oh. Did everybody hear her question? She asked about if the benefits themselves will change as far as like tier 1, the generics. Most of the drugs that are filed on our plan, they are generics as tier 1 drugs. The plan benefits are not changing. So it's just the transition to the new partner with Prime Therapeutics, but the plan benefits themselves, tier 1 drugs will still be $15 or less. Yes, ma'am. Her question was about the DMR process, and again, we are working toward that transition to ensure that it's very smooth, and that that members will be able to file for reimbursement as soon as we have more information, as soon as there's more clarity. As we work through it, we're navigating this on a daily basis. We'll send out all the information possible about that to make sure that your employees and you get your money as quickly as possible. Any other questions? Well, Arlene is sticking with us all day. So we're excited to have her. And also, a cool thing, Arlene has agreed, reluctantly, I think, she hasn't said, but she's going to be recording. So we do have the Covered Conversations podcast. I'm not stealing any of Jessica's thunder. And Arlene is recording an episode with us tomorrow. So we're going to have a little bit more information about Prime Therapeutics. We'll be sending that out as soon as it's available. So thank you so much, Arlene.